Friday, 7:30 a.m. on 88.7 FM, WGVE.
Welcome back to the new #1 morning show in Northwest Indiana. News, sports, education, and entertainment. Wake Up GI with Jeffrey Smith. Brought to you by the Geary Community Schools Corporation.
All right, everybody, we're back about 8 minutes after the hour once again on a beautiful Thursday. It's the 21st of March, 2024. And this is Wake Up GI with Jeffrey Smith. As I said before the break, ladies and gentlemen, I don't mind patting myself on the back. I'm winning 2 female doctors back-to-back on the show. Of course, shout out to new doctor, Dr. Dazia McLean, who was on here yesterday with us. And then, of course, our good friend, Dr. Janet Seabrook, who is a veteran in the game and also the proprietress of Community Health Net. It's always a pleasure when she drops by monthly. Make sure you always tune in when she does. What's going on, Doc? Hey.
Hi, good morning.
Let me cut your mic on. That's how it works.
Okay. Hi, good morning.
Yeah. Hey, what's going on? You doing all right?
Doing okay.
Yeah.
Lots going on. A lot of work.
Yeah. A lot going on. As I was telling you, we had Dr. McLean on yesterday, and I was telling her, as she's a second-year resident, and she's over here talking about the newbies that are coming in under her the first year. I was talking about how you and I have been having conversations and how much of an advocate you really have been to get some residents here in Northwest Indiana, and then how you kind of broke the news to me about the shortage of doctors around here. And so it was so refreshing to kind of get the wisdom that I always get from you, and then to see a very wide-eyed young lady jump into the profession. So it looks like the future is looking a little bright. Obviously, we can use some more people going into the field, but it was just pretty cool to see.
Yeah. So far, there are a lot more people interested in medicine.
Yeah.
In the field of not only being a physician, but nursing as well. So I hope that trend continues.
Right.
But people went through a lot during the pandemic, and people just got burned out, stressed out, and some decided to retire early. Some just didn't want to do medicine anymore.
Right.
And it's leaving gaps.
Yeah.
So it's very hopeful, that more residency programs will be started up.
Right.
And hopefully some of them will decide to go into primary care, because most of them want to go into specialties.
Yeah, you talked about that. Everybody wants to be a specialist.
Yeah.
But we need some general practitioners out there, don't we?
We need family medicine doctors. We need pediatricians. We need internal medicine physicians.
Mm-hmm.
Those physicians that know you from, your young age all the way up to your geriatrics. We just need that. Build that base.
And you and I talked about this because, usually if that vacuum or that hole isn't filled, something else comes along, and I don't really want us to get to the point, and you told me that in some places it's already here, where we have AI and the robots. You get what I mean? You walk into an examination room, the nurse or assistant asks you to kind of disrobe, and then the scanning starts. Yes. And then, no human contact whatsoever. And then you get a bill and a readout that tells you what your diagnosis is. We don't want that. We want humans.
But you know what? It's probably coming.
Oh, it is coming. It is coming. You know it's happening. So, you have a dual role now. You are the Commissioner of Public Health for the City of Geary, which you and I talked about. I really have always been fascinated with public health ever since back in school. So what are some of the things that you all are working on over at the health department?
So a couple of things. We're looking at ways to reduce infant and maternal mortality.
Right. And I asked you before, why is that so high? And why is that a thing in 2024?
For whatever reason, minorities, African-American women in general, and Hispanics, the care that they receive when they go to the hospital, I won't say that it's not up to standard, but a lot of times they aren't being heard.
Right.
When they're having issues or feel like, there's something going on with them. Patients know their bodies better than anybody.
Right, of course.
But what it boils down to is they're treated differently,
right,
and they're not heard. And typically, when you do have those losses, they occur with those warning signs, but
they're overlooked.
Or either because the patient isn't being heard, they're typically ignored until it's too late to do anything about it. And so what am I talking about? I'm talking about hypertension, not being diagnosed, even not being treated, moms needing to have emergency C-sections. And just here recently, a mom had the baby and then bled out.
Wow.
Right after having the baby. So the dad is going home with a newborn baby.
Without the mom.
No wife.
Right.
And so we just need to take those things into consideration. You know, how can we make these moms be heard when they are feeling that they are in distress and not being dismissed? This same mom had gone to the hospital multiple times to, you know, seek care, because she felt that something was not right, but because she couldn't articulate what it actually was.
So within the community, the medical community, that is, I mean, you know, is there conversations about this at conventions, at gatherings? Because there are, you know, off the top of my head, I see multiple ways that you can address this. The first one is something that we started to show off, and something that you've advocated for, and that is more participation from these demographics into medicine. I mean, you got to get people who come from these communities, who kind of are right there on the ground, to go out here, get the training, and then come back and serve these communities. You know, that appears to be the obvious one. But what are some of the things that people are talking about, like, you know, right now in real time? I mean, how do you let this kind of stuff slide? I mean, how does it get past these doctors?
So there are lots of conversations going on how to address this disparity that's going on in the United States right now. One of the things that people are looking at, groups are looking at, is have you ever heard of doulas before? Yeah. So the doula program is really growing in the United States right now, and having that doula who is trained, she doesn't actually they don't do the delivery. Yeah, they're like midwives. They don't do the delivery, but they're there in support and to advocate for the mom, to make sure that, you know, those sensations or pains or whatever the mom is feeling are being heard by those medical physicians. And there are a lot more hospitals starting to be more receptive to doula care. So I'm hoping that will grow over time. And then that there are studies and smaller pilots being done with doula programs all over the United States to see how this would work, potentially could work to help reduce infant mortality and maternal deaths. Because,
you know, one of the other things that I think about is, you know, kind of like a tracking. What I mean by that is kind of more education out into the community. And so when women are, you know, couples get pregnant, that they know about the resources available to them, so they can kind of start getting tracked, when to start seeing a healthcare professional, and then that healthcare professional can help them at every step of the way. Because I think a lot of times lack of education in the community is a problem. And, you know, probably like a lot of times maybe in situations, these mothers probably come in a little too late or something like that, and weren't not necessarily under the direct care of a healthcare professional.
One of the things that I'm an advocate for is free pregnancy testing. And at the moment that you find out you're pregnant, so I'll give for instance, at our office, if you have a positive pregnancy test there, we go ahead and do that first prenatal exam. If you haven't determined, you know, what your next steps are. So that's in the books and done. Because you don't want to wait too long in the pregnancy to have that first exam. And so I think that's early entry into prenatal care is one of the ways to put a backstop on that.
I like that.
So early entry into prenatal care. And then there's some, you asked me about some of the other things that we're looking at the health department. We're looking at creating a senior advisory council through the AARP.
Okay, that's smart.
So we can have a senior advisory council. So looking at things like walkable communities, you know, safe spaces for seniors to go out and get exercise and be able to be out and about in the community. So just creating those safe spaces, having the conversations with the seniors through utilizing AARP to help us kind of gather those members. and question them and find out, survey them and find out what
I think that's
areas
smart.
are. You know, how do you age in place in your home?
Yeah.
Do you need the bars in your bathroom?
Right. Oh, yeah.
Bars,
Yeah.
handles?
Yes.
Do you need a ramp? So looking at ways to help people stay in their homes in the community,
Yes.
if it's feasible,
Yeah.
if it's advisable. You know, where are the parks at that are close? You know, are there elementary schools in your neighborhood that have, you know, a play area?
Yeah.
So just trying to figure out ways to advocate for the seniors. And then another project, so infant mortality, maternal mortality,
Right.
the AAP Senior Advisory Council are some of the big things that we're looking
Right.
at. And of course, there's funding. We're looking at the opioid problem
Oh,
that we
my
have in the
goodness.
community.
Yeah.
And so
We have an
trying to-
opioid problem in this community.
we have an opioid problem. It's Northwest.
Yeah,
in
no,
general.
I know.
It's Northwest in general. And so trying to figure out programs
Right.
and maybe be an advocate for groups that are already doing the work, and then figure out how the health department, the public health department can support those programs that are already in the community.
Now, let me ask you this, because we've talked about this, I think, our last visit, and I want to ask about the progress, because obviously one of the things in public health is to look out for the health of the public, obviously, but I still argue that there's been a setback post-pandemic, in which people, for whatever reasons, we don't understand some of the political rhetoric that's out there, the conspiracy theories, but I would assume that, people's faith in vaccinations and things like that have really taken a hit. And so the medical community, public health community has to kind of reestablish that trust. And when you have situations, and we're right next door, and I asked you about this before, and it's not really a big problem here, because for the most part I've done a little investigating, and it does appear Northwest Indiana has been very good about vaccinations in the past years. And so while the measles outbreak isn't necessarily kind of where we need to get in a point of hysteria, it is a reality. When you cut on the news and you do hear about a disease that a lot of people thought had been dormant since like the 2000s, it's now rearing its ugly head so close to us. How do you go out here and kind of monitor this? Are there conversations that you're having, obviously, with the other cities and towns in the area? And, you're a doctor that operates all throughout the region, so you are already plugged in, as it were, with the regular public. You see people coming in and out of your clinics all the time, but where are we with this? Is it more of important to go out here and emphasize vaccinations as for school-age children and making sure they're up to date? Where are we with that?
So I think that, so you made so many points. So we're at a point where we have to continue to educate families, and meet people where they are. Find out, why they are hesitant to get these vaccines for their children. Is it because they feel like it's too much at one time?
Yeah.
So maybe we can look at, okay, maybe you won't get 6 vaccines today, maybe you only get 3.
Right.
And so start to have those conversations with the families that are vaccine hesitant, and find out the reasons for hesitancy. Try and arm them with as much information, verified medical information that you can, and having those conversations with them, making sure that our doctors, because sometimes these diseases have been off our radar for so long, and then somebody presents in your office with a rash, and you're like, what the heck is that?
I never saw this, I never saw this.
Because, in some residency training programs, you never see things like that. And I can remember clearly when we had a case of wild-type measles at Tatum.
Yeah.
And so the doctor, our attending physicians called us all in because we'd never seen it.
And he wanted you to see it.
Except for the textbook. We'd never actually seen it on the paper.
Right.
And so they wanted to make sure that we all got a chance to see
I bet you that attending physician was like Tom Skilling got with the weather. Just excited. You got to come here and look at this tornado.
And so I think that it's just important that we continue to advocate and educate our patients. Find out why they're hesitant.
Well, so does I'm not trying to give you more work or anything like that, but as the health department, do you get proactive? And what I mean by that is have education campaigns, because one of the things you're saying is right. There is a lot of misinformation. And even before the pandemic, one of the things that the anti-vax community was really doing is they were linking the measles vaccine with autism and all kinds of childhood ailments. I mean, that was really the conversation about when it came to vaccine. They all talked about the measles vaccine and what it was doing. And then, of course, we got COVID, and then it was a COVID-19 vaccine. But is it time to kind of have health departments go out here and be proactive and really start to have public forums, or maybe put some PSAs out there and educate people?
So that's one of the things that the health department is responsible for at the state level and at the county level and at the local level. It is our responsibility to make sure that we are promoting and educating the public on the things in the community that could potentially cause harm.
Right.
And so, yes, we will be, and the health department actually has a vaccine program. So there are vaccines available at the health department. So if people are ever wondering, well, how can I get my child vaccinated? You can call the Gary Health Department and find out, what time you can come and get those vaccines. But they are available at the health department. The health department works very closely with the school districts, particularly when it's, you have those kindergarten roundups, and you want to make sure that everyone has the vaccines that they need so they can attend school. It becomes very critical, too, with our seniors as they're graduating, to make sure that we get those vaccines in them before they graduate, because that was wavered during COVID, but it's been re-implemented, so they have to be up to date before they can get their diploma. So I think it's just very important, and that's the role of the public health department, is to make sure that the public is protected from communicable diseases. Yeah,
very interesting stuff. And so, lastly, as we talk about the health department, I've always wondered, obviously it's computerized now. Hopefully you're not using file cabinets and things like that. But how expansive is the database? Because, as I sit here and I look at, running the health department, you also have transient people that come through. You got to really be on top of this stuff, because Northwest Indiana, there's a lot of movement. And then, of course, we're right next to Chicago, which is an international city. And so you got to kind of stay on top of that. And obviously reporting from the various hospitals and clinics and physicians' office is important. So how do you kind of keep all that together?
So there are communications between the state health department and the local health departments through the birth certificates and death certificates. Those are digitally signed and recorded at the state level and at the county and at the city level. Birth certificates and death certificates. Then there's also, we call them DIS workers, disease intervention specialists. And they have to enter that data into the system when there are communicable diseases such as COVID and the measles, when those cases show up.
So that's like
their job to log that information into the system.
Are those people embedded in clinics and practices all throughout the area?
No, just at the health department.
Okay. So if I'm running my own practice, right? Do I have an obligation
to have a duty to
report daily or weekly, or just if I see something that's a little off?
You have a duty to report to the local health department and to the state health department diseases that, and they're all listed out. What are reportable diseases that could potentially impact the community. And so if that case of measles that I gave an example, we had to report that. That case was reported. You try and get as much information as you can because you need to trace where that individual has been when they were in the infectious state. So it's very important that, and our physicians know this, that they have a duty to report when there's a communicable disease in their clinic, in their office. That's
kind of interesting, because I remember you were here a couple of months ago when you kind of informed us that this nasty STD was on the rise. And I'm sure that comes from the reporting. Somebody's at their practice or at their clinic, they're like, you know what, we're starting to see a couple more cases of syphilis or this, and so we want to put everybody out on alert. So how are we getting on top of that?
So again, duty to report. So if these cases are coming into a physician's office, we have to report those cases to the local health department, and then they report to the state health department so these diseases can be tracked. Also, you have to make sure that, if there is an outbreak of syphilis, that there's enough medication to give to people who are coming into those offices to be treated. And so it's just very important that that's really the only way that we can track and know what's going on, where the hot spots are, so to speak. And we can go back to remember Scott County?
Absolutely.
A few years back? Yeah, and that was
what was going on there?
Yeah, with the HIV.
Yeah.
So when those cases started to come up, they were able to see the pattern,
right,
and just narrow it down to that one location, Scott County, and then be able to send all of the workers there to get a handle on it so it didn't spread any further.
Right, and what does that look like? Education, obviously the medical treatment of it, but now you're identifying it. And now do you get into some of the causes, the behaviors, or anything that goes into kind of slowing this? Because, you've got to go out here and be proactive in certain instances, I assume.
Yeah, so what?
Education.
Right, the case there was reusing needles and sharing needles.
Yeah.
And so they had to get permission, of course, but eventually they were able to get a needle program, or needle exchange program.
Right.
And that actually helped to reduce the spread of HIV. And I think the cases stopped at about 121 cases. But it was, first just a couple, and then it just started to explode. And once it got, past 40, then it started to explode to 80, and then next thing you know, we had over 100 cases of HIV from needle sharing in that county. So it's just very important that we're all on the same page. So like last week, I believe, the CDC dispatched itself to Illinois when those cases started to continue, because again, what happened, Chicago, where those cases were reported to their state health department, who has to report to the CDC. So the CDC is tracking those numbers across the country, and it's saying, it looks like it's really growing in Chicago, so let's dispatch ourselves there to assist with slowing down the spread and helping to track.
I love the relationship between Illinois and Indiana, because it's funny. I remember when the measles first started to make its appearance, the first thing that Chicago was saying, hey, they came from Northwest Indiana. They were over. Indiana had those cases. And then, of course, we ended up getting the first one that looked like it originated there, in which that young baby died. And, we're starting to see more. But, yeah, I just was very curious about the conversation. And it's very hard to control the movements of people with the way things are now. So, yeah, very good information. Let's kind of switch gears a little bit and kind of go back to something, because, I'm interested about this, about making young doctors. First of all, I want to ask you, there's a lot, and I'm like, I never get you into politics and things like that. But I've been having some, some arguments, not arguments, but discussions with people, because there was, I don't know where this came out of, but I thought it was the most insulting thing ever. And it was one community that was talking about lowering some standards for admissions because they needed more doctors. And so they wanted to lower the standards. And I basically, was talking, I was like, I know I get an opportunity on a regular basis to interact with black physicians, and they don't need the standards lowered. I mean, they rose up to the occasion, things like that. But what do you think needs to happen overall to go out here and get more people into the profession?
I would say to definitely not to lower.
Don't lower the standards.
No, because you want the best and the brightest to go into medicine, no matter the field, if it's being a physician, a nurse, or a scientist, if you want to go into research. We want the best and the brightest. We don't want to reduce our standards.
Thank you. Just to have more numbers.
No.
Right.
For me, that's just totally out of the question.
Right.
I think that you have to make it more, I want to use the word inclusive, but then I don't. So I'm trying to.
Yeah, because that's exactly what has spurred this conversation. I know there was Elon Musk even got in on it a couple of days ago. But yeah, because there is a concern that, I think the number still is about 5% minority within the entire medical profession. But there's also a conversation that, when it comes down to your field, you don't, you want to encourage more people to go into medicine who kind of come from these communities. But you don't want to go out here and make that the mandate of where you're just looking to just increase the numbers at any cost, because it is a very diligent profession. And, I guess you just have to get more people interested.
I think that is up to us as physicians or healthcare providers, professionals, to go out into our communities where people look like us, to talk about how, what the role of a physician is in the community, and the other things that are available in healthcare as well. Because I think people think about, just being a doctor or just being
Right.
a nurse or a medical assistant, but there's so many other things that play into running a medical office every day. And when you think about IT,
Right.
health IT, and the information and
Oh,
technology
yeah,
that we
yeah.
need to have at our disposal to be able to provide that care,
Right.
there's so many other things that are at play when someone goes to a medical visit.
Right.
So you don't necessarily have to be the doctor, but I would love to have, an IT person,
Right.
data driven, someone who did not, I want to talk about data as well, because
Right.
we get a lot of data
Oh
thrown
my
at
goodness.
us,
Yeah.
and we just don't have the time to digest it. So imagine having a data person there, or a quality informatics person that could
Oh.
squash all that data into one report for you.
Yeah.
So then you'd be able to see what your stats are almost on a daily basis. So
I like
there's
that.
so much more. So I think it's up to us to go out into the schools, the
Yeah,
elementary
yeah.
schools, middle schools, and high schools, even at the college level,
Well,
and talk to students.
I was reading, this was back during Black History, and I was reading about, how right during Reconstruction, when the Black American freedmen, down around Tuskegee and all that, the community went out and was very deliberate about making doctors. They were identifying people, physicians who were already existing. We're going out here targeting people and saying, we're going to put you on a path to be a doctor. And we were very deliberate in our communities. And then I'm talking with Dazia yesterday, and she went to Fisk, and she told me about a program that I didn't even know existed, in which they had a pipeline which was sending their students, and she was in this program. She was in the inaugural class that was sending students directly into Meharry. And it was just amazing. And so I would just suggest that, maybe we get creative and try to bring this down to put it into schools and high schools and things like that, because there are a lot of young people who, and you talked about this a while ago, that just don't know. You know what I'm saying? And when you look at some of our other communities, our Jewish communities and our Caucasian communities, a lot of doctors who kind of get into the profession, they're kind of picked out because they have a family member, maybe they see an uncle, or the doctor is very, local at their church or something. So they're closer to it. While in our community, it's still kind of like a choice. You got to go out here and, maybe you feel good about yourself, or you're good in school, and you say, you know what, I'm going to do medical school. Because I met a guy who had an electrical engineering degree and ended up going to medical school. He just was like, he didn't know he could do it, and he just ended up going to medical school. And now he graduated in engineering and went to medical school. Now he's a doctor in a trauma place. It's just crazy. So, maybe we have to be deliberate.
I think that you hit upon a good point. You do have to be deliberate. They also have to be shown the path too.
Yeah.
And I don't think that we're really showing our children the path.
No, they just know it's hard.
And that's all they hear.
Yeah, yeah, a lot of schooling and things like that. But I did think that that Fisk program was kind of cool. Yeah. Hopefully Tuskegee will get one, and maybe Hampton will get one. But that's kind of cool, in which you can kind of help an undergrad identify the pathway, and they can take their prerequisites, and they know the school is just a stone's throw away from Fisk anyway, so maybe at some point in time they even get an opportunity to go on campus. So that's kind of cool stuff. Yeah, let's get into just some of your general practicing that you do, of course, in Community Health Net. What's new there? Because every time I turn around, there's a new bus or something going around. What are you doing over there?
So right now,
chiropractic and all this kind of stuff.
We just brought on a family medicine doctor.
Oh.
Her name is Dr. Akuru, and she's at our Martin Luther King office, 3503.
You mean right over here?
Yeah, right
okay.
Across the street. And she is one of two of our regional medical directors.
Wow.
And so she's been brought on. It's just so
You're
much.
very corporate now, aren't you, young lady?
It's so much. When you have 8 locations, one person can't be the medical director for so many locations.
Right.
And so we've created a position called Regional Medical Director.
Oh, look at you.
And so Dr. Melvin Richardson is the Regional Medical Director.
I grew up with him.
You did?
He was a little Melvin, We were in Cub Scouts together.
Oh, my goodness. He is our Regional Medical Director for our Hammond location.
Yeah. Oh, my goodness.
And Dr. Okuru is the regional medical director for Fifth Avenue, for MLK, and for our Maribel location, I believe. Now, don't hold me to that.
I remember when I first came back and I saw that Melvin was a doctor. Not only I'm looking like little Melvin's now a doctor. When did you start getting into weight training? He's running around here with all these guns on his arms and stuff, man. He ripped. But yeah, so good stuff. So he's your regional medical director.
Yes.
Oh my God, look at you.
So that's
pretty much every doctor around here is employed by you now, aren't they?
No, no. And so yeah, so one of the things that I want to touch on before we get off of the health department, one of the other initiatives is the mobile mental health crisis team.
Okay.
And so we're working very diligently on that. What
does that look like?
Eventually what it will look like is there will be an organization that receives the contract, and you'll have 24/7, 365 days a year coverage for not those 911 calls. That
I was about to say, is this working with law enforcement?
This is working with law enforcement and with the paramedics and first responders to make sure that those calls go where they need to go. If this is a call with someone having a mental health crisis or breakdown, maybe their family has put them out of the family home and they're walking around outside being belligerent.
Yeah.
They don't have any weapons. They haven't threatened anybody. Maybe we can call out the mobile response team with the police.
Now, will they have to get any kind of training at all? Because that can be dangerous.
Oh, yeah. This you have to have at least 60 to 80 hours of training for the program to even be approved by SAMHSA.
Right.
So it has to be compliant with those SAMHSA, which is the Substance Abuse Mental Health Resources, just like Health and Human Services Division. And so what we want to do is make sure that they have been trained.
Yeah.
Not only the people who will be a part of the response team, but the police and fire department as well. And the response team has to work very closely with police and fire and have those lines of communication and trust. Because
that's a big deal.
It is a big deal, and the police want to know and want to believe that the mobile response team can handle the situation.
Will the police be involved? Yes. Will they be there at all?
So they may not be there necessarily, but having communication to say, okay, this is past where we can handle, let's bring in the police.
Okay.
There may be police in the background somewhere.
Yeah.
So
You're still working it out.
We're still working it out. Each program is different. Indianapolis has a hugely successful program.
Right.
And so we're partnering with them, kind of picking their brains to see what worked for them that could potentially work for us here in Gary.
Yeah.
But that is something that's on the plate under the umbrella of the health department as well. And I wanted to make sure that people were aware of that and that it hasn't fallen off the table, and there's very vigorous efforts to get that program up and running.
Right.
But I did want to talk about next Saturday, March 30th,
Go ahead.
which is Your Brand, Your Body. Make sure I'm saying it properly.
There you go.
Gary YWCA. I don't have the address. I know it's off of
150 West 15th Avenue.
150 West 15th Avenue.
Okay. And what time?
8:30 to 3.
8:30 to 3 p.m.
Yeah.
You're the keynote at the beginning.
I'm the keynote at the beginning.
A chat with the commish.
A chat with the commish. Okay, so I have to be there at 8:30.
You got to be there at 8:30 on a Saturday.
9:30. You kicking us off, Doc. You got to tell us the status of the health in the region. We're going to do a Q&A.
Look how you look at if your face.
Somewhere in there.
You got to be there early.
She'll be there. Meet the commissioner. She'll be there.
I have to bring my sleeping bag.
Stay there overnight. Sleep in your office. You're right down the street. Sleep in your office.
So, yeah, that's what's coming up next Saturday.
Yeah.
So we're real excited. Hopefully we'll have a lot of people come out. There'll be some vendors.
Oh, yeah.
Lots of vendors.
Demonstrations.
All right, demos. I'm not cooking, right?
No, but you're bringing your book, though.
I'm bringing my book.
Yeah, there you go.
Right.
Oh, you got your book?
Yes.
Oh, what's the title of it?
Cooking with the Doc.
Oh, that's right. I forgot about that. Your recipe book.
Yes.
Yeah, I got to get into that in a minute. I'm a foodie. Tell me a little bit about that book. And why don't I have one?
Oh.
We'll get you one, Jeff.
So it's really just recipes
that
I have taken and put a little twist and taken the salt out.
Okay, well, I don't use salt.
Okay, and just made healthy recipes that could either be a side dish, appetizer, or the main dish.
You know what? You are really pushing it with your friends at Big Pharma, aren't you? You just, you are going off the script.
I put all kind of targets on my back, from Silver Monday all the way through. Hey, might as well.
You out here promoting some holistic eating. What's your problem? Don't you know? You didn't get the memo. The blood pressure pills are buying houses. We're talking with Dr. Janet Seabrook of Community Health Net. She's also the health commissioner for the wonderful city of Gary, Indiana, and she's been just taking that job and running with it. And we appreciate what you're doing. So as we were talking before, we were talking about your clinic. You were talking about some of the things you offer. I know you're doing dentistry. You got the chiropractic, correct? What are you just one-stop shop, or you're just going to be a doctor super mall? What's that? What are you doing over there?
So what we're trying to do is make sure that patients' needs are met.
Right.
And one-stop shopping, if we can.
Right.
You can get everything done in the same building.
Yeah.
That's great.
You're going to get a podiatrist?
We're looking at it.
Okay.
You just read my mind. We have really serious.
Why not just do the whole thing?
Yeah. Why not?
Why not? Dentistry, podiatry, back. You can get your thing, get a masseuse in there, and a nice little fountain and some overhead music, and you got a whole little spa that place going on.
Yes.
Yeah. So basically, though, how's the thing going with the community schools? I know you were thinking about going into the side of West Side. Are we ready to start breaking down a wall yet? Where are we with this?
Well, the room that we're going to be in has been cleaned out.
Oh, okay.
Yeah. So right now we're just looking at how much things are going to cost. So until we're able to do that, we'll use the mobile unit. Right,
because I see that bus everywhere.
Yes.
I mean, oh my goodness. Who's the driver of that bus?
Right now it's our chief operations officer being at Asape.
Oh, really? So you got your COO driving the bus around. Everybody's got to roll their sleeves up.
Yeah.
And so, as I was asking, talk about some of the programs, the insurance navigation. That's one of the things that a lot of people that have gone to your clinic really are appreciative of, is because you have, I believe it's called sliding scale as far as their payments, and you help people fill out the holes in their insurance if they don't have it, and then even direct them towards insurance if they're looking.
Why are you asking me that? You know the whole program. That's probably better than I do. But yes, we do have, they're called health navigators, insurance navigators. And typically, if someone comes in and they need help with the marketplace and they're going online and they're confused, they come, and our staff have been trained to help them find quality, reasonable, affordable health insurance coverage. On their first visit, if they don't have health insurance coverage, that doesn't stop us from seeing them. We're not going to turn them away, and we do have a sliding fee scale. So people are able to have a quality visit at affordable cost.
You're one of the nice doctors, because I know there's some doctors out here, you tell them they don't have insurance, they throw you out like Uncle whatchamacallit did on the Fresh Prince. I know you got to get out of here, Doc, so I would get ready to let you go. Give me some real quick, your logistics of your business and hours.
Okay, 219-880-1190 is our phone number to our call center. And you can just go to our website as well.
Social media.
Community Health Net. There's Indiana.org. There's a whole bunch of information coming at me all at once. What'd you say?
Social media.
Oh, yeah, social media. We're everywhere. Facebook, Instagram.
You are.
Yeah. LinkedIn. Twitter.
Yeah, I know. It's just a lot, Doc.
It is.
All right. We appreciate you as always. I'll see you next month. Absolutely. Go out and do some stuff, Doc.
All right.